Hello, hi, good evening, friends. I'm Dr. Mahesh Nair, founder and director of Nipantech Aesthetics Panampedi Nagar, Cochin, and once again I'm back with another YouTube live session. This time, the topic for the session being rhinoplasty and overview. Why an overview? Because rhinoplasty is a very vast topic, and I would like to cover it in series of videos wherein I take you through an overview, wherein you will get to know a little bit about all of it, and then we can touch upon selective topics which you can also ask me certain questions in the comment section below, and I come up with more and more answers to them, so that will create content for the subsequent videos as well. And moreover, in-depth things like who needs a rhinoplasty, when should you get it done, why you should get it done, and how it is done, and what are the prerequisites, what happens after the rhinoplasty, so on and so forth. So all these kind of questions will be answered by and by in the rhinoplasty series. And coming to the main issue, that is the rhinoplasty in itself. Now, rhinoplasty, I know it's a fancy term. So the normal layman language, it is called as a nose job. What that means is basically your nose is worked upon to change the shape or the size or the function or a combination of all of this to remodel your nose or to reshape your nose. Basically, it means that you're going to get a better looking nose for sure. Definitely, that is the whole idea of getting a rhinoplasty done. At the same time, its function will also be enhanced. Suppose if you have breathing difficulty, recurrent sinus issues, or you've been told by your ENT surgeon that there is a deviated nasal septum and you need to fix that, then yes, definitely you can undergo a rhinoplasty. That does not mean at that same time you should undergo only a septoplasty. You can even undergo a septorhinoplasty. What that means is basically we will correct your septum and at the same time fix your nose to make it look somewhat to what you want it to look like. Why I said that is because many a times, not many a times, but at least sometimes we do come across clients who have some unrealistic expectations from their nose jobs, and then either they are let down or we are let down or a combination of both, and that's quite a disharmonious scenario kind of. So it's better that you and I are always on the same page, especially when it comes to rhinoplasty, because nose is something which is paramount to facial aesthetics. It sits right in between the nose, in between the face. It doesn't move. It's not a mobile part, so you can't change it in different angles. All you can do is change your photography angles. You can't see, like for example, cheeks. Okay, you can do this, you can do this, you can make them look fat or thin a little bit, little like your tummy, for example. You can pull it in and take a snap, but you can't do that with a nose. If a nose is there, it is there. So that's why people do seek rhinoplasty when they come to know that, especially in the selfie generation, that doctor, my selfies don't come good in this angle, in this particular angle. My nose looks big from here, looks big small from here. And the younger generation is more and more forthcoming in this matter, because they, what I can say, uh, watch their nose with a very critical viewpoint, or their face for that matter, not just the nose. But here, since we are talking about rhinoplasty, I'll just stick to the nose. So those critical points they come and discuss with doctor. When I see my nose from here, this looks bulgy. When I see my nose from here, this looks like depressed and things like that. Well, to a certain extent, they are right at times, but more or less it is how good the camera skills are and how good the camera itself is. So those factors also do play a role. Like you have a fisheye effect if you take the selfie cam too close to your face. Your center looks bulged up and the sides look small. Similarly, if you take the camera a little too further away, your face looks more proportionate. So there is a distance, there's a way in which these selfies or these shots are basically taken. So you may require some professional help to get those streamlined. That is one thing. Rhinoplasty. Okay, who is the candidate? Now, this is another question that usually comes to me because I've got clients ranging from the age of 15, 17 also sometimes. My nose is too big for my face or it's too small for my face and I'm not happy. Well, you have to wait for the completion of your facial skeletal growth. What that means is basically till your puberty ends, till about the age of 18, 20, sometimes even 22, your facial skeleton keeps changing. Your nose, the shape of your nose, the size of your nose, your cheeks, your temples, everything, has to settle down. And once it settles into the adult form, only then can we think of a rhinoplasty. Why? Because suppose you do a rhinoplasty and then your face changes a little bit, and you don't like the nose, then you'll need what is called a revision rhinoplasty or a redo rhinoplasty. And trust me, that's not really a good proposition, because a primarily done rhinoplasty is always the best. The primary rhinoplasty is always the first and the best attempt at it. So choose your surgeon wisely, again, who is who is proficient in doing rhinoplasties, who he or she, whoever it is, and then decide upon what job do you exactly want in your nose to be done. Now, many a times my clients are very clear in their concepts, like what they want from their nose, whether they want reduction, I mean decrease in size, increase in size, decrease in this flare called as allarplasty. So these all small things can be combined together to deliver a whole nose job, in the sense, a transformation, a nasal transformation. Well, that does not mean that your nose, like you get Shah Rukh Khan's picture and show me that I want this nose. No, that is not going to happen, because you may not have that much of tissue to, his nose is big, frankly, like mine. So the thing is, you may not have that much tissue available over there to make your nose that big. So there are limitations, there are practical limitations which we have. So in rhinoplasties, basically, so we have to come to a common consensus as to what your rhinoplasty will look like at the end of it, and what you can expect in the long term. Of course, it's more or less a permanent result, because the nose does not change much with age. Of course, the skin quality changes, it droops a little bit with age, but not like in 10-15 years, maybe after 20-30 years. But well, that is inevitable. You can't like really bank upon the fact that my nose is going to look exactly the same like what it is at 20 and what it is at 60. So there's a vast difference of age in between, in that much time. So who are good candidates? Yes, definitely. Smokers do not heal that well. The nose is a very tiny area, but it is a very complex area. If you go to see, the skin over the nose differs in its thickness. The thinnest here, intermediate, and the thickest over here, which it may be very oily as well. So the skin keeps wearing. You have a cartilage, you have soft tissue, you have bone. It's a mixture of a lot of structures put together. So one has to be very careful. Even, I mean, we as doctors also have to be careful while with handling the nose, as well as you as a patient in its recovery as well. So nose is a very unique structure. It's just singular one, the one in the face. There are no spare noses available with you. So you have to be careful with its recovery as well. Yeah, we have jotted down a certain points which we would like to touch upon. So what is rhinoplasty? Now, you know, that's a nose job, basically to remodel or reshape your nose to give you a better function as well. Now, what it can achieve and what it cannot, these are very important to understand, because your expectations should be realistic, in the sense, my nose is too big, I need to make it small. How small? That there also a limitation lies. I cannot make it too small. I cannot give everyone a Barbie nose. I mean, recently my Instagram had one post on that, and I got a flood of queries. Can my nose be made into a Barbie nose? Well, no, not all noses become Barbie noses. So one has to understand the limitations. Okay, you want to make your nose a little bigger. How much bigger? So we can make the nose big. We can make the nose small. We can make it narrow. We can make it more broad. Well, nobody comes to make their nose broad, but well, even that can be done if needed. So these all little things can be done. This bridge of the nose nose can be made narrow. The tip can be refashioned. If it's a bulbous big tip, then it can be made narrow. This region can be made sharper. The radix, what we call the root of the nose, can be made to project a little higher, giving it a better definition. The ala, that is this region of the nose, can be brought in. Some people, when they smile, they get this ala flare, so that can be reduced. Then your tip, suppose if it is drooping, then that can be adjusted, that can be taken up, down, or if there is a deviation, if there is a twist in the nose, that also can be fixed. If it is septal, if it is bony, that we analyze. In certain cases, we may need a CT scan to look inside your nose and your sinuses, basically. How are they placed, or how deviated the septum is, and doing which maneuver will help me correct it and give you a straightish nose. Okay, not all deviations are 100% correctable, mind you. I'll be very honest and frank with this, that in some deviations, especially when there are bony deviations, and to a very large extent nose is deviated, all of it cannot be fixed back to 100% normalcy. We may reach 80-90% of what I can say, straightening it in an attempt to straighten it, but it cannot sometimes happen in anybody's hands for that matter, that it becomes 100% normal. Sometimes there are limitations. So all these factors have to be considered when you consider what is possible and what is not possible. Hence, I prefer, especially before rhinoplasty, to have at least 2 or 3 consultations. It is, I know it is time consuming, it is grueling, but at times it is very much necessary. First, it's like I talk, you talk, I listen, and I talk, you listen, and third, we discuss it out as to what needs to be done in your nose and how can we help you achieve it. Because everything what you ask may not be deliverable, and everything what we can deliver may not be suitable for you. So there is a lot of give and take in that, and one has to understand. Ancillary procedures nowadays are quite common with rhinoplasty. What that means is basically we can do some facial fat grafting, we can do an eyelid surgery, or a brow lift, or a lip lift, or a lip reduction, or otoplasty, that is getting your ears back towards the skull, or maybe a little jawline contouring, chin contouring. All these small facial aesthetic surgeries, or buccal fat removal. So all these can be combined with a rhinoplasty. Of course, if you ask me that day to do a tummy lipo or a 360-degree liposuction, no, that is going to be prolonging the operation theater time, and it's generally not advisable to combine too many procedures together. So might as well have a shorter period of general anesthesia now, and maybe 3 or 4 days later you can get yourself operated again. That's perfectly fine, because rhinoplasty does not as such have a very prolonged downtime. The downtime in rhinoplasty is on a lesser side. Hence, we get a lot of foreign clients as well who come in, fly down, and go out. I'll be coming to that a little later as to what kind of protocols we have in the pre-op and post-op phase. So that was one important thing, what to expect in a rhinoplasty. One is that. Then, am I a good candidate for nose job? That I just answered. Yes, you would be if you're, if you're not smoking, not an avid smoker or a chain smoker. Then your age matters, and you should have realistic expectations, a good mental composure, an overall general good health. These are all the little things that matter. Those are not little, but they do matter a lot. So rhinoplasty and psychology. Yes, I purposely jotted down that one point. Why? Because many a times I get these clients telling, doctor, fix my nose, I'll get this job. Fix my nose, I'll get a better bride, or whatever it is. Well, no, that is not the solution to the problem. Even after the rhinoplasty, you may not land up getting it, or even without a rhinoplasty, you may get it. So don't attribute your bodily, what I can say, um, I've just lost for words, but do not attribute your body towards your success or failure. That has nothing to do with it. It is just luck, chance, whatever opportunity, and the way you crack it. So rhinoplasty and psychology are very deeply connected. We realize that many a times these patients, they need some counseling as to. I have refused to do a lot of rhinoplasties because I have got several times very young people who, under the exam pressures or something, they're not able to crack an exam, or study pressures are there, and they're like, doctor, fix my nose and then we will do this. I said, like, no, that doesn't work that way, and it's better to be safe than sorry later, because these are the same people who may come back later and tell me, doctor, if you knew this, why did you do it in the first place? So it's better to be on the to err on the side of the less, of course. So the power of rhinoplasty, yeah, this is what I wanted to discuss more or less. Power of rhinoplasty, what I mean by that is, rhinoplasty is a very powerful tool in the plastic armamentarium. Why that is so? Because you can even masculinize or feminize a face with just the nose. You might have observed, even in your day-to-day life, there are individuals who look otherwise very masculine or feminine, except for their nose. The nose is opposite. So a nose can make a lot of difference in one's face. An overall good-looking female may suddenly, the facial profile may vary when she has a parrot beak-like nose, and that merits a rhinoplasty. So there are some cases which we just see and we are like, okay, fine, you really need a rhinoplasty. Come on, let's start away with it. And there are some cases where people unnecessarily find a lot of nitty-gritty nuances in their nose, saying that, oh, this is a little bit here, this is a little bit there. No, that does not merit a rhinoplasty, because rhinoplasty is a serious business. It's a serious affair. We are tinkering with your nose, and your nose is in the face. You can't hide it. Well, in Corona, the good thing was there was a mask with which you could hide the nose. So a lot of rhinoplasties got done, and the recovery was within the mask itself. So that really never bothered a lot of people, because the masks were already there. But all said and done, no jokes. Rhinoplasty is a serious surgery, and it is a full-fledged surgery performed under general anesthesia. So weigh your pros and cons, and then definitely think about it or get in for it, go in for a rhinoplasty. So that is why I'm saying again and again that a rhinoplasty can either make you look more masculine or make you look more feminine. One does not assume, that a fixed structure in the face can transform your appearance so much, but it does, mind you. So that's why sometimes we do show sketches or morphed images in certain softwares to the clients, saying that you look like this now, and you may once again I'm telling you, you may look like this after your surgery. Why I said may is because when I do the surgery, I aim, or any surgeon, when he or she does the surgery, we aim to achieve the best, or we aim to reach our goal. But there are certain factors which are patient oriented factors, like healing, for example. Okay, one does not know how much time you're going to take to heal completely. Some heal very fast, some heal slow, some heal in a very haphazard, rough way. So those are all patient related factors which we can't really govern. Hence, when we show you a morphed image, it is not like the Bible saying that this is it and this is how it's going to be. No, it is somewhere going to be close to it. It is not somewhere, it is not going to be exactly a replica of what we have shown, but maybe it may come to somewhere 19-20 ho jayega, and you will still get a nose which you can flaunt definitely, for sure. So that is one prerequisite that we have in the consultation. Another thing what I would like to tell before a rhinoplasty, yeah, of course, so it's like mostly for generally for all general surgeries, in surgeries in general anesthesia, basically do not consume foodstuffs where like vitamin E supplements, excess green tea, excess garlic. All these supplements basically lead to increased bleeding, and that can be disastrous for a rhinoplasty, just as smoking is. So before a rhinoplasty or any facial aesthetic surgery, I request normally people to cease or stop smoking 1 week at least before, and 3 weeks after the surgery. Why? Because my surgical result will definitely be better when that confounding factor of smoking is omitted from the picture. So smoking, then these supplements, then of course there are a few certain set of instructions that we ask you to follow, like do not take blood thinners for about a week before the surgery. Then of course, any general anesthesia surgery, we prefer to have a bystander or a relative or somebody with you, friend or family, anything will do, who can come and take care of you, or to take you back home and to sign you in. These are all for medical legal reasons. So rhinoplasty is not something, because I have had these experiences where people have come secretly and told me that don't tell my family I'm going in for a nose job, and it needs to be a secret. I said, how? I mean, how are you going to keep it a secret? For about 1 week, you're going to have a plaster on your nose, right in your face. And for the 1 week later, you'll have a tape on your nose. How is it on earth that you're going to hide this? So anyway, that's one issue in itself. Then you won't be able to fly for about 2 weeks after the surgery. So mind you, this is all for my foreign clientele who keeps coming down. Do not ask me to let you go off in a week's time or 3-4 days time. Depends again what all you have done. Suppose in a rhinoplasty, if you have just done LR plasty or a tip plasty, yes, you can definitely fly. But if I've done a septal work and an osteotomy or a bony work, and I want your nasal mucosal passages to come down to normal, then I'll ask you to wait for some time rather than fly off immediately. So in general, you may also need a week or two off from work because of the bruising, swelling, and the tip looks like Pennywise's nose, maybe red. Plus you'll have dressings and plasters, so maybe work from home is possible. But generally, in an more or less, keep about a week or two in your hand, rather than having 3-4 days and then telling, oh, now I want a rhinoplasty done. No, rhinoplasty needs planning, and for that planning, who better than a plastic surgeon to approach and discuss? Give me your schedule, and I'll try to customize your rhinoplasty in and around it. So that's what we are here for. That's what the consultation is for, and that's why I don't like those Instagram consultations or WhatsApp consultations, and those um, um, light-hearted video consultations. No, surgery is a serious affair for us. It's our profession, it's our passion. So please give it due respect and come and meet us, because we are not here to misguide you or something. We will definitely guide you to the best of our capabilities, so that you get the best result what is possible from this. So that is about the prerequisites of the surgery. Then you have the we may also start you sometimes, especially this is seen in South Indian noses what I operate. So if the skin is very thick and sebaceous, like very oily and very, very thick skin, which is very common in South India and all, so those kind of skin need some kind of medication like isotretinoin tablets and all, to bring down the sebaceous content or the activity in the skin. So the skin becomes a little softer and suppler before we operate. We can even begin it after, but generally before is better, so that even our operative field is good enough and we don't have to struggle with the result in that scenario. Because the thicker the tip skin, the longer the time it is taken for the tip to settle down. So definitely it takes time. So these are the prerequisites. And after the surgery, what can you expect? Well, this is a very common question asked. How many times do I have to come to meet you, doctor, after the surgery? So surgery, what I'll do is I'll discuss it separately in another video, wherein I'll discuss the what I can say, the closed approach, open approach, what is possible, what is not possible, what is alaroplasty, what is tipplasty, what is dorsal hump reduction, all the technical mumbo jumbo I'll deal with all later, because that's a separate video. This is an overview video. So post surgical, what you can expect is definitely not an overnight stay. That much, I mean, you'll be very relieved to hear that rhinoplasty at our place in our hands does not require an overnight stay. You go home the very same day. Even if we have taken a rib for the augmentation rhinoplasty, the rib graft and all, even if you have taken that, or the ear cartilage or the temporal fascia, whatever we have taken, you're going to go home safe and sound that same afternoon or evening. So because the rhinoplasty surgery lasts about 4 to 5 hours, depending upon what all works are being done in the nose. So recovery is not that brutal or grotesque. So you go home the same day. Then you have to meet me after 48 hours or so that I remove the nasal packs. Till that time, you will not be breathing from the nose, you will be breathing from the mouth. So that is one thing that one has to be careful about and keep in mind. You may have a light headache kind of, and you're not supposed to eat anything hard or anything chewy, like a chewing gum. That your teeth movement and your jaw movement is going to move your nose a little bit, and that's going to lead to pain. So obviously all the discharge medicines we give you while going, and in that there are a lot of painkillers, there are anti-inflammatory agents, there are swelling lowering agents, there is an antibiotic, there is a mild steroid which will not make you fat, don't worry. So all these kind of things are there. It's a nice gift hamper, I can say. So it's a hamper that you have to diligently follow the post-operative protocol that we have set for you. And after 48 hours, we remove the nasal packs. Then I call you at 1 week or 5 days to remove these stitches, the columellar stitches, what we take to close the nose. So only these stitches will be removed. The rest of the stitches which are inside are absorbable. I mean, they're dissolvable. So they dissolve on their own, and we don't have to sit and manually remove them. So don't worry. After the surgery, I'm not going to inflict any pain on you. That's the second visit. And the third visit is usually at the end of 2 weeks, when the second visit, I even change the plaster. So at the third week, I change the tapes which are there on the nose to hold the structures together. Third visit may or may not be there depending upon what all jobs have been done. But generally, 2 visits are mandatory: the 48-hour one and the 1 week one. The third one may or may not be there. So you don't have to come too often to meet me, but these are very important, and your result may or may not be apparent very, very immediately. Like, see, the gross changes definitely. Like, your nose was broad and you brought it in. Yes, that will be observable right when we remove the plaster at 1 week. The eureka moment when the plaster has come off. You might have seen a lot of Instagram channels of plastic surgeons where they demonstrate, the plaster removing session and the nose reveal session and all. So those are fun times, because usually the result is good and it's liked by the patient, and we capture those fresh moments, and it's really fun to see that. So those are the 3 times when you will need to visit us. Of course, in between that, avoid bending down. Try to sleep with 2 pillows behind your back for at least 2 weeks. Do not avoid coughing and sneezing. Avoid going out for too long. Your facial skin is a little delicate, so use a good sunblock at that time. And what else? The very, very basic precautions. So we give you something called soul spray or saline spray, basically to spray in your nostrils to keep them smut free and keep them scab free. So use that saline spray to keep your nostrils clear. You can use a moist earbud with 50-50, like 50% hydrogen peroxide and 50% water, or we'll give you the solution from here anyway. So with that, you can clean the nostrils and clean this area. You don't have to literally sit and douse it with a lot of water. Don't do that. Avoid it. Be gentle with your nose, which has been recently operated upon. Anyway, when you have the plaster, you can have a full-fledged bath, so you may need a wet wipe for your face for about 2 weeks. So be mentally prepared for that you may not get to wash your hair. If you need to do that, then you need to go to the parlor where they put your hair behind and they wash it so that your nose remains dry and clean. So that is generally seen after the surgery. Do not again eat hard foodstuffs. Eat something which is soft for about 2 weeks so that your nose doesn't move much, and you'll be able to drive after about a week. Not with the plaster, of course, which is going to be there for a week. So after that, you can definitely drive. No inadvertent injuries. That's another reason why we don't let you drive. Our roads are unpredictable, so do not drive or ride a bike. And there was one more important thing that I wanted to, yeah, light exercises and all. You can begin after 2 or 3 weeks. Yes, this is a very common question. Like, it's even applicable to me for that matter. What to do with my specs, doctor? I have to wear it 24/7. Well, if a spectacle is really mandatory to be worn 24/7, like how I am supposed to wear, so do not wear spectacles with a base like this. You need something which has those pegs, which can sit on the plaster or which can sit on the dressings in a very light manner. Use very light frames and light glasses or plastics. Or the safest way is to go in for contact lenses for that point of time. I know many people over there are not comfortable with contact lenses. There are only two ways left. One is use a very light frame, be very gentle, try to remove it as far as possible whenever you can. And second is hell with everything, I'm going to use my specs no matter what. So those are the 2-3 approaches that you can use. But primarily, if we have done a nose job, especially with a graft or something on the dorsum over here or the root of the nose, avoid wearing a spectacle as far as you can. A contact lens at that time will really work wonders, because your rhinoplasty is going to be permanent. It's going to be a permanent result sticking with you. So be very, very careful on that front. And anything else? Oh, I guess that covers most of it. The crusts in the nose. Yeah, some people get very much bothered about that. So you can use nasal saline spray. We give you that when you go from here. So that will help you clear your congested nose. Yeah. So for the first 1 week or to 10 days, you may have a stuffy feeling in your nose. That is very much normal. Don't think we have buggered up your nose and now you can't breathe. You were breathing better before and now you can't. No, that is not the scenario. The mucosa and all is inflamed. It has to come down. It has to settle down. So give it a week or 10 days or 2 weeks at the max, and all of it will come down. You can use Otrivin nasal drops to get down the congestion, and it will come down faster. So all these little things we give you as handouts, so that in the post-operative period you can just glance through or read through. We of course give them much beforehand. So in our practice, what I do is I discuss the consent with you when you're with me for a consultation over here. What my rhinoplasty can achieve, what it cannot achieve, what are your expectations, what are my expectations, how am I going to achieve this in your nose. All that is discussed. It's a part and parcel of the consent. And I might, on insistence, if you really need the consent, I'll even email or WhatsApp it to you. Sit at home, read it, show your lawyer also if you wish. But it is important that you read what the consent states. That is number one. And secondly, even this instruction manual, what you're able to follow. Smoking, for example, some people just don't want to give up smoking. And if I know that I have to thin his tip, okay, the nasal tip, which has anyway got a precarious blood supply, I will not go to that extent to thin the tip. So one is, do not hide anything from the surgeon, please, for heaven's sake. Your life depends in our hands, and our life also depends in your hands. So do not hide anything from the surgeon, especially. So be honest. If you're smoking, tell how much you're smoking, and don't hide history. So that is very, very important. And do not consume blood thinners before the surgery. So those are some of the points which I wanted to discuss in a rhinoplasty. Where have I written down the other questions? I think this is it. I think this is it. Yes. So if you have any more questions, feel free to put in the comment section below. You can get in touch with us on the numbers mentioned over here, or it's there on Google everywhere, frankly, guys. You can just get in touch and ask your basic doubts, ask your basic questions. I know one of your basic questions is the cost of rhinoplasty. The cost of rhinoplasty, as this is an overview video, I can definitely tell you it's very variable, because rhinoplasty itself is variable. Show me two noses that are the same, and I'll tell you that it's going to cost different for both the noses for the rhinoplasty, because we don't know what it's like a very customized surgery. We can't predict exactly what are we going to do as the next step, and each step has different consumables. So that's where the cost varies. So rhinoplasty can come, for example, an allarplasty, that is just getting this part inside under local anesthesia, if the remaining nose is also narrow. So there are certain parameters that we need to assess. So an allarplasty can cost you somewhere around like 60,000. But if you want a full-fledged rhinoplasty with with a rib graft and all, that can go up to as high as say 2.2 to 2.5 lakhs as well. So there's a wide range. We cannot put a finger and tell you like, your rhinoplasty is right now going to cost you, that too on telephonic consultations. Mind you, I'm being asked this left, right, and center on Instagram. How much will a rhinoplasty cost? How will I know? I have not seen your nose. I have not analyzed your nose or deconstructed your nose. I need a plan first to deliver to you that, okay, I plan to do all these kind of things, and hence the cost of your surgery is going to be 1.5 lakhs. So It is highly variable, guys. Please understand that it is not a car showroom where I can tell you, SX variant costs this much and LX variant costs this much. No, it is not that way. Even many times they are not able to tell the cost because of the taxes that keep fluctuating. So these are the little nuances that we have in rhinoplasty or any other cosmetic surgery. They are not like we don't have a cookie cutter approach. Like you tell me one surgery and the rates are out kind of. That never happens because every individual is different. Everybody's body is different. How it is going to respond, react is different. We have to use certain more drugs in more quantity in some people, because sometimes some people are difficult to anesthetize. You must have all heard that some people just don't get the anesthesia effect, so then we have to use more drug. You have to use more of the gases, and all these things cost. So the thing is, that's why the costs also vary. So that I know that was a very important question for me to have answered. So now you know the rough estimates of how the surgery goes. So if you have any more questions, do feel free to ask, and I'll be in touch. Let me see what topic can I come up with for the next Insta Live or YouTube Live. Suggest me, guys, what do you all want, and we can touch upon those topics. Thank you so much for your patient listening, and until then, goodbye, good night.